use it for my back to start. I do this every day as well. So because my back is in pain, I basically use my body weight to bridge up and open the facet joints. So I lay back across it. I'm gonna have my arms overhead, and I'm gonna be rolling back and forth using my body weight and bridging to feel those facet joints open. Obviously, if you're unable to get on the ground, unable to balance like this, or are uncomfortable with it, don't do it. But it really does help open the spine up and release some of the tension. You can also then roll to the side, and you can do shoulder foam rolling as well, because the posterior capsule in the shoulder gets very tight as well. And so if you can soften that up, you'll have less shoulder problems. But you can also use other devices. If you have specific points that are giving you trouble, a ball massaging into that deep area will help decrease some of the scar tissue and break it up so that you won't be in as much discomfort. As far as for the lower extremity, my hamstrings are very tight as well. So I bridge up, so I'm taking all of my weight off the legs. I'm crossing my legs over. When you think about what we normally do is we do static stretching. It's just where you stand and you stretch, or you sit and you stretch. What this is, it's a combination of static and dynamic stretching. When you sit on your hamstring like this, you can feel where the tightness is. Some people are lateral, mine is medial. So I cross my legs over, I'm stretching while I'm doing this, and then I'm rolling back and forth, because this gives a soft tissue massage to break up the tissue, break up the adhesions, and soften things up while I'm stretching. So I love this as a combination exercise. Things I don't want you to do is I don't want you to go too far up because you can get into the sciatic nerve area, and I don't want you to go too far down because the popliteal area has some blood supply, blood vessels, as well as nerves. So I just want you rolling right over that hard tissue back and forth. This will help loosen up the hamstrings and increase your flexibility. As far as the IT band goes, I then take it and roll to the side. So while I'm balancing on this, I roll back and forth again, and I'm going to keep moving back and forth to get the different areas of the band to try and soften it up. Once again, I don't go to the knee and I don't go up to the trochanteric area, because that's where your pain is, and I don't want to irritate the bursitis. I just want to stretch out that band. And so sometimes you're not going to be able to do this, and I'll show you a different way to do it that would be beneficial for you. I then flip over on my stomach and I do both quadriceps, and then I use this for the adductor. So one of the other ways that you can do it is, as Ryan talked about, is you can do the stretch of the hamstrings. So you're stretching it out here, and then I take the foam roller. This is a foam roller, and once again, you can have a texture one or a straight one. But while I'm stretching that hamstring, I can feel that tightness, and I'm gonna take this and roll it across that area. That also will help to soften it up. This is a little easier if you're having difficulty getting up and off the ground. So this may be a little bit more beneficial for you, but that would help to soften up the tissue, increase your flexibility, and decrease your pain in the lower extremity.